Nursing. Part 2 of Emergency Terrorism and Disaster Nursing. Every year, over 5 million animal bites are reported in the United States. The most significant problems associated with animal bites are infection and mechanical destruction of skin, muscle, tendon, blood vessels, and bones. The bite may cause a simple laceration or may be associated with crush injury, puncture wounds, and tearing of multiple layers of tissue. Dog bites are usually on the extremities and may involve significant tissue damage. However, facial bites are common in small children. Most victims own the dogs that bite them. A plastic surgeon should evaluate all disfiguring wounds of the face. Cat bites are deep puncture wounds that can involve tendons and joint capsules. There's a greater incidence of infection with septic arthritis, osteomyelitis, and tenosynovitis occurring. The most common causative organism of infection in dog and cat bites are from Pasteurella species. Most healthy cats and dogs carry this organism in their mouth. Human bites result in puncture wounds or lacerations. There's a high risk of infection with oral bacterial flora and hepatitis virus. Oral flora most commonly involves Staphylococcus aureus, Staphylococcus, and hepatitis virus. Hands, fingers, ears, nose, vagina, and penis are the most common sites of human bites and are frequently a result of violence or sexual activity. This is a picture of the result of a human bite. The initial treatment is to clean with copious irrigation, debridement, tetanus prophylaxis, and analgesics. Individuals at greatest risk of infection are infants, older adults, immunosuppressed patients, alcoholics, diabetics, and people taking corticosteroids. Animal and human bites are left open if they're puncture wounds. Lacerations are loosely sutured, and wounds over joints are splinted. The patient is admitted for IV antibiotic therapy when an infection is present. There is increased incidence of cellulitis, osteomyelitis, and septic arthritis in these patients. Report animal and human bites to the police as required by law. Rabies prophylaxis is essential in the management of animal bites. The initial injection of rabies immune globulin and then a series of 5 injections of human diploid cell vaccine on days 0, 3, 7, 14, and 28. It's important to know that this vaccine is very expensive and the patient should be told this, but it shouldn't hinder treatment. And arrangements can be made, although sometimes it's not easy, with the CDC and sometimes the manufacturer of the drug to help the patient pay for the cost of the prophylaxis. Poisonings are chemicals that harm the body accidentally, occupationally, recreationally, or intentionally. The severity depends on the type, concentration, and route of exposure. More than 5 million cases of human poisonings happen every year in the United States. Natural or manufactured toxins can be ingested, inhaled, injected, splashed in the eye, or absorbed through the skin. Table 6911 presents common poisons. The management of poisoning is to decrease absorption, enhance elimination, or implement toxin-specific interventions per poison control. The options for decreasing absorption of poisons include activated charcoal, dermal cleansing, eye irrigation, and less frequently gastric lavage. The administration of cathartics, whole bowel irrigation, hemodialysis, urine alkalinization, chelating agents, and antidotes increase the elimination of poisons. Gastric lavage is to intubate the patient before lavage if there's an altered level of consciousness or a diminished gag reflex. Perform lavage within 2 hours of ingestion of most poisons. It's contraindicated if there are caustic agents, co-ingested sharp objects, or ingested non-toxic substances. Activated charcoal is the most effective intervention, administered orally and via nasogastric tube within 60 minutes of poison ingestion. It's contraindicated in diminished bowel sounds, paralytic ileus, or ingestion of a substance poorly absorbed by charcoal. Activated charcoal can absorb and neutralize antidotes, so do not give immediately before, with, or after charcoal. Dermal cleansing and eye irrigation are used, and skin and ocular decontamination is the removal of toxins from the skin and eyes using water or saline. With the exception of mustard gas, toxins can be removed with water or saline. Water mixes with mustard gas and releases chlorine gas. Decontamination takes priority over all interventions except basic life support measures. Enhancing elimination includes cathartics such as sorbitol that's given with the first dose of charcoal to stimulate intestinal motility and increase elimination. Or it can be done with whole bowel irrigation. Whole bowel irrigation can be effective for swallowed objects such as cocaine-filled balloons or condoms, and heavy metals such as lead or mercury. Hemodialysis is reserved for patients who develop severe acidosis from ingestion of toxic substances like aspirin. Sodium bicarbonate administration raises the pH to greater than 7.5, which is particularly effective for phenobarbital and salicylate poisoning. Vitamin C is added to IV fluids to enhance excretion of acetaminophen and quinidine. Chelation therapy is considered for heavy metal poisoning, such as edetate calcium disodium, or calcium EDTA, for lead poisoning. Violence is the acting out of emotion to cause harm to someone or something. It can be caused by organic disease, psychosis, or antisocial behavior. The patient cared for in the ED may be the victim of violence or the perpetrator of violence. Violence can take place in a variety of settings, including the home, community, and workplace. The ED has been identified as high-risk areas for workplace violence. Family and intimate partner violence is a pattern of coercive behavior in a relationship involving fear, humiliation, intimidation, neglect, and/or intentional physical, emotional, financial, or sexual injury. The Emergency Nurses Association encourages ED nurses to become certified sexual assault nurse examiners. The SANE nurse provides expert emergency care, collects and documents evidence, and participates in staff and community education, and advocates for sexual assault and rape victims. Family and intimate partner violence is found in all professions, cultures, socioeconomic groups, ages, and genders. Most of the victims are women, children, or older adults. Every year, over 5 million women and 3 million men are treated in the emergency department for battery by spouses, caregivers, or individuals known to them. As many as 20% of battered females are pregnant at the time of the assault. Screening for domestic violence is required in the emergency department. Appropriate interventions might be making referrals, providing emotional support, or informing victims about options. Barriers to conducting effective screening include limited privacy for screening, lack of time, and lack of knowledge about how to obtain information regarding family and intimate partner violence. Terrorism involves overt actions for the express purpose of causing harm. Disease pathogens, for example bioterrorism, chemical agents, and radionuclear explosive devices are involved. Table 6912 summarizes general information regarding biologic agents of terrorism. The agents most likely to be used in a terrorist attack are anthrax, smallpox, botulism, plague, tularemia, and hemorrhagic fever. Botulism is treated with an antitoxin. Anthrax, plague, and tularemia are treated with antibiotics, and smallpox can be prevented or ameliorated by vaccine even if it's given after the first exposure. There is no established treatment for most viruses that cause hemorrhagic fever. Chemical agents of terrorism are categorized by target organ and effect. Sarin, for example, is a toxic nerve gas that can cause death within minutes of exposure. It enters the body through the eyes and skin and acts by paralyzing respiratory muscles. Antidotes for nerve agents are atropine and whatever that says. Phosgene is a colorless gas normally used in chemical manufacturing. If inhaled at high concentrations for long enough periods, causes severe respiratory distress, pulmonary edema, and death. Mustard gas is yellow to brown in color with garlic-like odor. It irritates the eyes and causes skin burns and blisters. Radiologic dispersal devices, or RRDs, or dirty bombs, are a mix of explosives and radioactive material. When detonated, the blast scatters radioactive dust, smoke, and other material into the environment, resulting in radioactive contamination. The main danger from the RRDs is explosion. The radioactive materials used in an RRD are generally uranium or iodine-131. They usually don't generate enough radiation to cause immediate serious illness, except to those victims who are close in proximity to the explosion. Ionizing radiation, like a nuclear bomb or damage to a nuclear reactor, is a serious threat to the safety of casualties in the environment. Exposure may or may not include skin contamination with radioactive material. Initiate decontamination procedures immediately if external radioactive contaminants are present. Acute radiation syndrome develops after a substantial exposure to ionizing radiation and follows a predictable pattern. Explosive devices as agents of terrorism result in one or more of the following types of injuries: blast, crush, or penetrating. Blast injuries from supersonic overpressurization shock waves that result from the explosion damage the lungs, middle ear, and GI tract. Crush injuries with blunt trauma often result from explosions that occur in confined spaces and result in structural collapse or falling debris. Some explosive devices contain materials that are projected during the explosion, such as shrapnel, leading to penetrating injuries. An emergency is any extraordinary event that requires a rapid and skilled response and can be managed by a community's existing resources. A mass casualty incident usually involves large numbers of victims, physical and emotional suffering, and permanent changes within the community. In addition, mass casualty incidents always require assistance from people and resources outside the affected community, such as the Red Cross. When the emergency or mass casualty incident occurs, first responders, such as police, emergency medical personnel, or fire, are dispatched. Triage of casualties differs from usual ED triage and is conducted in less than 15 seconds. There's a system of color-coded tags that designate both the seriousness of the injury and likelihood of survival. Green is minor injury, or yellow. Non-life-threatening injury indicates a non-critical injury. A red tag indicates a life-threatening injury, and a blue tag indicates those who are expected to die. A black tag identifies the people already dead. Casualties need to be treated and stabilized. If known or suspected contamination, decontaminate at the scene and then transport to the hospitals. Many casualties will arrive at hospitals on their own, walking wounded. The total number of casualties a hospital can expect is estimated by doubling the number of casualties that arrive in the first hour. Generally, 30% will require admission to the hospital, and half of these will need surgery within 8 hours. Communities have initiated programs to develop community emergency response teams. CERTs are partners in emergency preparedness, and training helps citizens to understand their personal responsibility in preparing for a natural or man-made disaster. Training includes the teaching of life-saving skills with emphasis on decision-making and rescuer safety. CERTs are an extension of the first responder services. All healthcare providers have a role in emergency and mass casualty preparedness. It's important to have knowledge of the hospital's emergency response or preparedness plan. Participation in emergency and mass casualty preparedness drills is required. An emergency response plan includes individual roles and responsibilities of the members of the response team. Participation in emergency and mass casualty incident preparedness drills is on a regular basis. Drills include hospital disaster drills, computer simulations, and tabletop exercises. The response to mass casualty incidents often requires the aid of a federal agency. That really depends on where you live. One important aspect of the National Incident Management System is the development of an incident command system. This standardized organizational structure provides for the management of all incidents. The National Disaster Medical System organizes and trains volunteer disaster medical assistant teams, called DMATs. DMATs are categorized according to ability to respond to a mass casualty incident. DMATs are deployed within 8 hours of notification and remain self-sufficient for 72 hours with enough food, water, shelter, and medical supplies to treat about 250 patients a day. In a small community, a mass casualty incident is often considered, or a disaster, is considered whatever overwhelms the available resources. So, a single family of 4 that has all serious burns can be considered a disaster and activate the emergency preparedness system. Or an automobile accident with 5 or 6 casualties can also stress the system and be considered, for their purposes, a mass casualty incident. Hospitals do disaster drills at least twice a year. Sometimes they do tabletop drills, and sometimes they do live drills. And it's really to activate the system and see what works and doesn't work so that you can think through problems before they happen. If we have time in class, we can talk a little bit more about this. So let's do a couple questions and wind up this section. While performing triage in the ED, the nurse determines which patient should be seen first. The patient with burns on the face and chest, BP 120/80, pulse 92, respirations 24. A patient with a deformed leg indicating a fractured tibia, BP 110/60, pulse 86, respirations 18. A patient with type 1 diabetes and ketoacidosis, BP 100/60, pulse 100, respirations 32. Or a patient with a respiratory infection with a cough productive of green sputum, BP 128/86, pulse 88, respirations 26. The correct answer, I hope you picked, was C. A triage system identifies and categorizes patients so that the most critical are seen first. The Emergency Severity Index, or ESI, is a 5-level triage system that incorporates concepts of illness severity and resource utilization to determine who should be treated first. Initially, the nurse would assess the patient for any threats to life or the presence of a high-risk situation. The patient with diabetic ketoacidosis is the most critical. Assessment of a male patient during a primary survey indicates delayed capillary refill of the extremities. He can't explain the events before admission to the emergency department. Which action should the nurse take immediately? Apply leads to the patient's chest to initiate an ECG monitoring. Insert 1 or 2 large bore IV catheters to start IV fluid resuscitation. Continue the primary survey to complete a brief neurologic exam, or initiate pulse oximetry by placing a monitoring device on the patient's index finger. The correct answer would be D. The primary survey focuses on airway, breathing, circulation, and disability, and exposure or environmental control. It serves to identify life-threatening conditions so that appropriate interventions can be initiated. The nurse may identify life-threatening conditions related to airway, breathing, circulation, and disability at any point during the primary survey. When this occurs, the nurse should start interventions immediately and before moving to the next step of the survey. The patient has decreased oxygenation, and further assessment with pulse oximetry is indicated. And finally, several patients are admitted to the ED after exposure to an aerosolized agent that's believed to be a hemorrhagic fever virus used by a bioterrorism agent. Which statement by the nurse is most appropriate? Treatment for this viral disease is mostly supportive. Cipro is the best treatment for this disease. This disease cannot be spread by contact with body fluids. A vaccine is available to prevent transmission of this disease. The correct answer is A. Only supportive treatment is available for hemorrhagic fever. A vaccine is available for yellow fever only. The disease is carried by rodents and mosquitoes and through direct person-to-person contact with body fluids. The virus can be aerosolized. Ciprofloxacin is used to treat a bacterial infection.